I never even dreamed that we would be in this situation that we're in. Never ready for it, and when it does happen, it just blows your mind.
Never thought anything like this would ever happen to me. Just an ordinary girl.
When he got here, he couldn't move anything but a finger and a toe. He was on a ventilator, he had a trach. He couldn't do anything for himself.
Facing a health crisis like a stroke, brain, or spinal cord injury is tremendously daunting. But after the individual has been stabilized in the hospital, the next important decision is where to go for the right medical treatment and rehabilitation. Research shows that inpatient rehabilitation hospitals deliver higher quality medical care and better outcomes than nursing homes.
An inpatient rehabilitation hospital is a hospital where a patient who has suffered a brain injury, a stroke, a spinal cord injury, or some other life-changing event can come to receive both medical care from a specialized physician, but also can get the intensity of therapies, including physical, occupational, speech, and also recreational therapy.
It's very common early on after an injury or an accident to be very much overwhelmed and very much afraid of what's ahead of them. And the team of inpatient rehab professionals will help them step by step.
Rehab is not one point in time, it's a continuum. Rehabilitation physicians and staff move people along that continuum.
Inpatient rehabilitation hospitals, on average, and national data has proven that their outcomes are better, which means that patients go home and stay home. They don't go home and bounce back to the hospital.
A recent study shows that individuals treated first in an inpatient rehab hospital have better outcomes than similar patients treated in nursing homes. These patients return home sooner, spend more time at home, have fewer return visits to the hospital, live longer, enjoy a better quality of life. Compared to a nursing home, at an inpatient rehab hospital, patients receive individualized care and treatment 24 hours a day, 7 days a week, from physician-led teams and specialized rehab nurses. Furthermore, physicians visit their patients every day.
The number one goal is to achieve the best possible clinical outcome and functionality for the patient.
These are patients that require 3 hours of therapy on a daily basis, versus a nursing home where a patient will receive about 45 minutes of therapy 5 days a week.
When we talk about 3 hours of therapy, that's spread out throughout a patient's day. So a patient, if they can tolerate an hour of therapy at a time, that's what they would receive. If they need rest breaks and need to lay down between therapies, we would customize the treatment towards that.
Select Medical has one of the nation's largest networks of leading rehab hospitals, equipped with the latest technology and hands-on treatment. They specialize in treating and rehabilitating people who have had a stroke, brain injury, spinal cord injury, or a condition like Parkinson's or multiple sclerosis. Kenneth Klunk woke up one morning thinking he had bitten his tongue, but he went on about his day mowing the grass and working on his car. As it turns out, Kenneth was having a stroke. He spent 9 days in a traditional hospital before finding the right inpatient rehab hospital.
Because of his disposition that he has and his attitude, he needs somebody that's going to keep on him and make him do what he has to do. And there was really nobody around our area that would do that. We decided that this would be the best facility because of all the things we have heard.
It was the best thing for me.
Caitlin Elliott had just started her senior year of high school when she was nearly killed in a car accident and sustained a brain injury. She stayed in the hospital for 5 weeks before she was stable enough to be moved. After researching facilities, including nursing homes, her family chose to move her into an inpatient rehab hospital, knowing it was the right setting.
She did not know how to walk. She did not know how to talk. She couldn't move any part of her body. As soon as she got in the rehab hospital, they were doing everything with her, sitting her up, dressing her like normal, and teaching her how to do all these things again.
I almost think that there were more days that I wanted to give up than there were days that I didn't want to give up. On those days, they would bring in the therapy dog, and they would lay him with me and be like, you just spend some time with him, collect your thoughts, like we'll give you a little bit of a break. And then, like, we got back up and we started doing therapy again.
Larry Sanderson and his wife were vacationing at the beach. While Larry was boogie boarding, the ocean opened up and waves sent him crashing to the ocean floor. He suffered a severe spinal cord injury. He spent 19 days in critical condition before being moved to an inpatient rehab hospital where he could achieve the right outcome.
I met everybody right away. It wasn't I had to wait or anything. I met the therapists, and everybody from day one laid out what was going to happen for him and to him. I mean, he had to learn everything all over again.
I told him from day one, I said, push me, push me, push me. And I told him a couple of days later, I'm going to walk out of this place.
After 42 days of inpatient rehabilitation, through personal determination and a specialized team of rehab professionals, Larry was able to walk out of the facility.
The rehab hospital gave me a second chance to live again.